be demonstrating how to do a chest tube dressing change and also administer packed red blood cells for blood transfusion. So I reviewed my physician records and I see that we have an order for 1 unit of packed red blood cells over 2 to 3 hours and a chest tube dressing change that needs to be done. I've also reviewed the IPN from the night shift and I see that the patient has given consent for a blood transfusion and also they understand the risks associated with blood transfusion. I also have seen that there was an active cross match done. So I'm going to start with a second nurse because the blood just came up. Along with the second nurse, I'm going to start by comparing the record of transfusion with the demograph, the record or the patient demograph. So I'm going to spell and the nurse is going to check. So we have Atrique Jerry, Atrique, Jerry, Jerry, the fin 261824375. That is all correct. So then we go and we take the record of transfusion to the blood tag. So we have Atrique, Atrique, Jerry, Jerry, fin 261824375. Blood type AB positive, donor number C051080900445. That is correct. So then we go blood tag to blood bag. So second nurse is looking at the blood bag. So we have packed red blood cells, packed red blood cells. We have AB positive, donor number C051080900445. The cross match expires in 3 days, and there are no modifiers. So that is good and well. Now we will go to the patient's room and confirm we have the right patient. So upon entering the room, I do a safety check. The bed is at the right height, and the patient's already in semi-Fowler's, so we're happy with that. I see quickly that the chest tube is looks to be connected correctly, and I see the sections on. So, hello there, Mr. Atrique. Can I get you to tell me your first and last name? Oh, great. And your birthday? Okay, great. So I think I have the right patient. So along with the nurse, I'm just going to ask the patient, can you spell your name for me? Full name? Okay, that's great. So, and then I also will have the nurse look at the tag and I will spell the name Atrique, Atrique, Jerry, Jerry. That is correct. And fin 261824375. That's correct. So we are confident that we have the right patient. So the tubing is already here and hung, and the line is already primed. It's being primed with normal saline. Now, normally we would have an additional bag of normal saline for emergencies, just in case transfusion reaction with its own dedicated line. I see that this is a blood line. It has the appropriate filter and it's portless. So I have done my calculations, and what is going to happen is I'm going to set this line up. For the first 15 minutes, we're going to run so we have the rate at 50 because we're going to monitor for transfusion reaction, and then it is the volume of 358. So we're going to confirm this. We're going to also label the line for blood products.
Hi, my name is Jenny, and I'm going to be showing you how to administer PCA as well as how to do a chest tube dressing. So before I begin,
there it is. Blood products. Okay, so then we've confirmed this and we're going to start. So what we're doing is for 15 minutes we wait and assess for any transfusion reactions. We also watch for the 3 gyps. Just kidding. So we definitely didn't start it here because we didn't hook it up to anything. So we perform hand hygiene, and we're gonna don a pair of gloves. We're getting a little bit ahead of ourselves, but that's okay because nothing was wasted, because everything is kept and locked off, and we would have had big time downstream occlusion. So I have my line here. I'm going to clean my port for 30 seconds and let it dry for 15. And then we're going to flush for patency. And the line is patent, so we're happy. So now I'm going to move that and hook up my blood. That is all hooked up. So now we would, again, primary start running at 50 milliliters an hour. Primary start. Okay, so it's running. We assess for any transfusion reaction for 15 minutes. Over this 15 minutes, 12.5 would have gone through. So after 15 minutes, we stop the transfusion and we want to run it at the regular rate. So 12.5 taken away from 358 comes to 345.5. We'll round up to 346. So 346 is the volume, and the rate 346 divided by 2 ends up being 173. So this will no change. We will confirm primary, and we will start, and then we will watch for 3 drips. Where, of course, we ensured that all the clamps were open, and they were open even for those 15 minutes. So now we remove gloves, and we will continue to monitor the patient every 15 minutes for vital signs for an hour, and then 30 minutes for an hour vital signs. Then after that, every subsequent hour. So Jerry, it's time to do your chest tube dressing. You know the drill, yeah. So perform hand hygiene again, and I'm gonna don a new pair of gloves. I'm assessing the suction over here. See that the suction is on low suction. We have our forceps to check for air leaks, and we have our sterile water in case the chest tube is pulled out. The suction container is intact, and we're gonna follow the line now to the Chlorovac dry suction machine. We see that it is set to 20 centimeters H2O, and the bubble indicating that suction is on is up in the middle. We see the air leak meter. There's no jacuzzi bubbles, so we know there's no air leak. We see there's no frank red blood or purulent drainage. It's good serous sanguineous drainage. If there was drainage, that's what we'd want, and we mark at the beginning of our shift so we can do accurate ins and outs. We also would check for dependent loops and or kinks in the line. So I'm just gonna get you to raise your arm. Thank you. And we're just gonna go ahead and get this dressing changed for you.
So then before I start to run this, I'm just gonna do a review.
So I'm going to open my sterile kit here.
The numbers are 479. So this is the right patient. The medication she's getting is morphine. The dose is going to be 50 milligrams.
Okay. So we don't need this drape. That's okay. That didn't affect the borders of the kit.
And signature should be mine and NURS.
Try the rest of the side.
Review. Concentration should be
Okay. And we don't need that either.
no loading dose.
And
Also try
Put it back.
now, okay, so we're gonna introduce drain sponge into the kit. Drain sponge introduced. We're also going to introduce our Jello net into the kit.
So then before I run,
Very
I'm
good.
sure that this is the right
now the dressing is dry and intact, but we're still gonna remove it, making sure to stabilize as we pull it off.
Primary line is using a TKO, so I don't necessarily need to flush this for frequency. I'm just gonna assess the site, making sure there's no redness or small
Okay.
pain.
And we're gonna remove the gelinette with our still sterile tips of our blue forceps.
But before that, I would
Gelinette removed, and those forceps are garbage. So now we remove our gloves that we're currently wearing. And we grab a new pair,
swab this cord for about 30 seconds.
and we do some hand hygiene.
15 seconds has already been passed.
I'm going to put some sterile water into my kit, making sure not to
And again, it's already been fine.
not to spill.
Then what I'm going to do is that because I let go of this, I need to alcohol swab. So again,
And we're gonna be using no touch. So
there we go. So is everything all connected? It's been primed. Everything is
that is within the 1-inch border, so I'm not concerned about it. So now I'm gonna go ahead and
Before I hit run, I'm just going to call my buddy nurse over, and then we will do our third checks together. So because for the sake of time,
with one swipe all the way around, and then we'll get the underside of the tube with that. Try to be efficient, and then we're gonna do
so then what I'm going to do is that I'm just going to give the
another swipe
I'm also gonna add my
farther out,
okay. So as everything
and then we'll just give the underside of the tube a little more, and
my
then
gloves and apply.
we're going to get the top of the tube with this one.
And then I'm just going to educate my patient a bit about the PCA. So then now as the PCA has
To the
been
top
done
of the
and
tube,
prepared,
just like that.
all you have to do is that with this button,
The tube is kind of moving in and out, but normally it would be stitched, and it wouldn't do that.
button.
So now I'm going to try with a 4x4
The purpose of having morphine is just for pain management.
to get a larger
Now keep this
area.
in mind that you have that 5-minute lockout interval, so that means that if you try to press
No
the button
saline.
less than 5 minutes, or say 3 minutes from your initial
Okay,
press,
and we'll get the
morphine
bottom
will stop
dry.
in order to- And also, you want to ensure that you must press it for yourself. You cannot have another family member or doctor or nurse press it for you. Okay, so you must press it
And
for
the top
yourself.
dry.
And so some symptoms or side effects you
Okay,
can experience with
so
this
now
one
I
are
can
such as
prepare my
drowsiness,
gelinette.
dizziness, or you may notice a slow breathing rate. So if you notice these symptoms, just notify me or my buddy nurse immediately. But other than that, before we move on, do you have any other questions here for me? No? Okay. So then before I move on to the chest, I'll just show you how to check for bolus attempts and good. So you just have to press 5, and this will give you the bolus attempt. And then just
Twist
do
it up a
go
little.
back.
Put them back in the lowest position, do an active check, making sure all the section is still where it should be.
And then of course
Okay.
I would lock this up before I move on. So I locked it.
Place
Now
this
we're
on. You want to ensure occlusal dressing. Now, I probably would have raised the height of the bed
So then I'm just
for
gonna do my safety
me
check here.
because I'm
So what I
tall,
wanna ensure is
but it's
that
okay.
The canister is connected
So
to the
I've
wall.
touched the skin, but I've cleaned that area,
Ensure the suction is in low continuous suction.
so it's okay.
20 to 80 mercury, so it's
Also, I didn't verbalize, but I assessed
And I
the
would just
site.
follow the tutorial
Uh,
and ensure there's no pain.
I assessed the site when
Underneath it. So then I would just lift this patient's arm. Just so that
okay, this one is only one in the
dressing, so
package.
making sure that it's dry and taut.
So I'm gonna put this one on and open a new package, get another one. But I assessed the site for any signs of infection and purulent drainage, and there was none.
Ensuring that the red dial
So I'm making sure to orient my
sterile water in case if the tube has been dislodged. And then
my drain sponges not in the same direction, which I've done. And now I'm going to put on my 4x4 over top. Again, my forceps did touch the patient's skin close to the site, but it was not contaminated because I've cleaned the skin, and when putting on the gauze, we're staying on the outside of the gauze to be sure. Okay.
Okay, so now what I'm gonna do is
Taking bed. Okay, that's one. And then my next piece is signed and dated. And then with this piece, we're going to make sure to tent. Okay, tented that piece. Okay, Mr. Atrique, we're all done with the chest tube dressing change. That was the best one you've had. Thanks. So, also, we did ask if the patients had any allergies. They had no allergies. We're going to leave the patient in the safest, lowest position, and we're going to go and document our findings, and I will return at the appropriate times as stated earlier for the blood transfusion. And of course, the patient has the right to refuse, and the patient received the appropriate education, and that's it.